welcome to my channel. I apologize for my raspy voice from the sore throat. Today's topic is distortions of the hand. So before we begin, let me tell you that I won't be explaining anything in this video. It's simply a chanting video which will help you memorize the factual information. So for distortions of the hand, we have to understand that at rest there is a balance between the flexors and the extensors of the hand, as well as the intrinsic muscles of the hand. Okay, in particular which intrinsic muscles? Lumbrical muscles. So at rest there is balance between the extensors and flexors of the hand and the intrinsic muscles. Which intrinsic muscles? Lumbrical muscles. Now clawing is seen with distal lesions, and a less pronounced clawing of the hand, or clawing only when they are trying to make a fist, is seen in proximal lesions of these nerves. Okay, so now we know that lumbricals have the function of extending at the metacarpophalangeal joint and flexing at the DIP and PIP. Again, lumbricals will extend at the metacarpophalangeal joint and extend at the and flex at the DIP and PIP joints. Again, they extend at the metacarpophalangeal joint, they flex at the DIP and PIP joints. So if you have the distortions of the hand in front of you and you don't see the word claw, that means it is a proximal lesion. If you see the word claw in the name of the distortion of the hand, that means it is a distal lesion. Okay, so if you have ulnar claw, then it is the distal lesion of the ulnar nerve. If it is median claw, it is the distal median nerve lesion. Now, because these are distal injuries, that means they will be present even at rest. Okay, because in distal injuries you have a more pronounced clawing, so even at rest, or even when you're extending the fingers, which is also at the rest, because the lumbricals extend at the MCP during rest. Okay, now if you do not see the word claw in the distortion of the hand, that means it is a proximal lesion. Now how will you tell if it is a ulnar or a median nerve lesion? Is by looking at when you're trying to make a fist and only your third and the fourth lumbricals are able to flex when you're trying to make a fist, and the other three are extending when you're trying to make a fist. That means the problem is in the median nerve, because the thumb, the first and the second lumbricals are innervated by your median nerve, and the third and the fourth are innervated by your ulnar nerve. Third and the fourth in the sense the ringer and the little finger. Okay, so Pope's blessing is proximal median nerve, and it is seen while making a fist. Now okay gesture is when you're trying to make a fist, only the thumb, the first and the second lumbricals are able to flex, and the other two remains in their extended position. That means the problem is in the third and the fourth lumbrical, which are innervated by your ulnar nerve. Okay, so ulnar claw, distal ulnar nerve lesion. Median claw, distal median nerve lesion. Pope's blessing, proximal median nerve lesion. Okay gesture, proximal ulnar nerve lesion. Okay, thank you. Have a nice day.